Shivam, you can start. We are live.
Hello and welcome to BW Healthcare World. We are live and today is World Thyroid Day, and we will be talking about the common thyroid disorders, their prevalence, symptoms, possible treatment options, and what one can do to prevent these disorders. It is estimated that nearly as much as 42 million people in India are affected by thyroid disorders. And to talk on these subjects and on more, we have with us Dr. Ankur Pruthi, who is the HOD and consultant nuclear medicine at Manipal Hospitals, New Delhi, with his field of expertise lying in radionuclide scans and therapy. Welcome, Dr. Pruthi. It's a pleasure to host you here. Welcome on the channel.
It's my pleasure. Thank you.
Dr. Pruthi, let's start with a common overview on into thyroid disorders. What are thyroid disorders as per you? Can you give us an overview into common thyroid disorders and their symptoms and their possible prevalence in India?
So, as you already gave a very brief and very nice introduction regarding the thyroid disorders, so I would start by some very basics of thyroid. Thyroid is actually a butterfly-shaped organ situated in the anterior portion of the neck, and it produces some very important hormones, namely T3 and T4. So T4 is very commonly known as thyroxine. So thyroid basically utilizes the iodine in the food or in the our body constituents, and then it utilizes this iodine to produce these hormones. And these hormones are actually very important in regulating the entire metabolism of the body. So metabolism is a process by which our food is converted or transformed into the energy. So these T3 and T4 hormones, they regulate the body metabolism and they regulate body weight, pulse rates, blood pressure, body temperature, the metabolism of various our body nutrients such as fats, proteins, glucose. So all this is actually regulated by thyroid gland. So thyroid also in turn is controlled by another endocrine gland in the brain, which is known as a pituitary gland. So pituitary gland basically produces one hormone known as thyroid stimulating hormone, which ultimately goes and controls the thyroid gland functions. So regarding the disorders, many times we come across people, or they just say that I have thyroid problem, but they don't know exactly what kind of thyroid problems are there. So usually what we commonly come across, the thyroid problems are of mainly two types. One is due to reduced functioning of the thyroid gland, which we commonly say as hypothyroidism. The other is due to raised functioning of the thyroid gland, which we term as hyperthyroidism. So other than that, there are some other disorders such as thyroid nodules or goiters. Then there are thyroid cancers also seen in thyroid glands. So these are the common disorders which we encounter related to thyroid gland.
What would be the symptoms of these common disorders?
Yeah, so as I told you that these T3 and T4 hormones produced by the thyroid gland, they ultimately control the body metabolism. So when there is reduced production of these T3 and T4 hormones, so this situation is known as hypothyroidism. So the people usually have symptoms such as weight gain, weakness, excessive sleepiness, there is constipation, hair fall, skin is mostly dry, then they feel excessive cold as compared to the people around them. So these are usual symptoms, and there are some menstrual problems like delayed periods or reduced flow in females, in young females. And on the other hand, the symptoms produced by hyperthyroidism or increased functioning of thyroid gland, they are completely opposite, such as weight loss, nervousness, warm extremities, excessive sweating, heat intolerance. Heat intolerance is when the person is not able to tolerate slightest amount of heat, and they feel that they should switch on the ACs and fans all the time, and all these are very common symptoms. Then they have watery stools, loose motions, and palpitations, tremors in the body. So these symptoms someone should be very much aware of, and should be readily investigated.
Right. But there are also symptoms that sometimes show on the neck of a person, and that turns out to be a goiter, or that turns out to be another disorder, which is, commonly known as a different name in Hindi. What, how do you differentiate between the, symptoms that come on the neck?
Yeah, so the symptoms which I earlier mentioned, they generally means they don't produce that much effect on the neck. Yes, so the people should be very much aware of any of the swelling if they feel in the neck, because thyroid gland enlargement is sometimes seen, and this is known as goiter. So this goiter can be a diffuse goiter, because when the entire thyroid gland is symmetrically enlarged, so then it produces a diffuse goiter. But sometimes some nodules or some lumps, they are also seen in some portion of the thyroid gland, so they produce nodules. So they can be some nodular goiter or a multinodular goiter when multiple nodules are there. So if I would say that there is a small risk of these nodules turning cancerous also. So people have to be very much vigilant if they find any of the growth in the neck, especially a nodular one. These need to be investigated, and they should always be more alarmed if there is rapid increase in the growth, or if this nodule of the growth is having any of the symptoms such as compression or discomfort. So they need to go to a doctor and get themselves evaluated.
Right, right. What would be the possible causes of these thyroid disorders? Do we know the causes of thyroid disorders?
I would take you back around 30-40 years back. So at that time, the thyroid enlargement, especially the goiters, they were very prevalent in India across multiple rural and urban divides. So it was found that there is iodine deficiency in the diets, and this was particularly seen in the people living in mountains, in hills. The diets were particularly deficient in iodine. So as I already told you that for production of the T3 and T4 hormones, thyroid gland utilizes the iodine which is present in the food. So if the diets are deficient in iodine, then the thyroid gland is not able to produce that much hormones, and it ultimately leads to enlargement of the thyroid gland, which we commonly term as goiter. So I think 30-40 years back, the government started this iodization of salt program, wherein iodized salt was distributed free of cost, and all the salt was fortified white salt, table salt, which we commonly use. So after that, the incidence of these goiters have actually declined, because we have moved from iodine deficient to a somewhat iodine sufficient area, means population. So this was one of the cause of goiters, but other than that, in iodine sufficient populations, some autoimmune disorders are there, where the body's immune function, it starts acting against our own tissues. So these autoimmune disorders is one of the very major causes in iodine sufficient population for thyroid disorders.
Also, could these be genetic?
Yeah, means a major chunk of thyroid disorders are actually genetic only, because they are transferred from one generation to another. Some are very hereditary, especially the hypothyroidisms, and so yes, they have a genetic component.
So it could be possible that one might be, taking care of their iodine needs, but because of the genetics, they might end up having thyroid disorders.
Yes. So basically, we can't control a lot of factors. Yes, iodine is one of the very important factors which, with the help of governments and with the awareness campaigns, people have have controlled these things. But yes, autoimmunity is not under our control. Then genetic factors are not under our control. Yes, one another important factor which I missed earlier is the impact of radiation. Radiation on the neck, especially in the childhood days, that can also lead to thyroid disorders in the late adulthood. So all these unnecessary radiation exposures of X-rays and CT scans, they should be avoided to prevent these thyroid disorders. Yes.
What is the what is the age we are talking about here when we're talking about children, their exposure to radiation? What is the age group that you think would be?
Less than 14 years. Less than 14 years is very susceptible age group. So usually the doctors also, they tend to avoid these radiation investigations such as X-ray, CT scans. Yes.
Okay.
And though means there are many other investigations which can be done in other than these X-rays, such as an ultrasound can be done and MRI can be done. Yes.
Right. Moving to the diagnosis of thyroid disorders, how are thyroid disorders best diagnosed, and what are the tests that one can go through, and what is the significance of accurate diagnosis in thyroid disorders?
So we have already told about the symptoms. We have already told about lumps and enlargement of the thyroid gland. So the first thing which anyone should do if they are having any of the suspicion of these thyroid illnesses is first they should visit their doctor, and the doctor will first of all evaluate the patient, examine the patient, and after that they will order some set of investigations. So means I will give you a list of investigations, but they are not done in each and every case. They have to be tailored according to the complaints of the patient. So the very first investigations which generally the patient has to undergo is blood tests. The blood tests which are commonly done are thyroid function tests. These are including the levels of hormones T3, T4, and TSH. Sometimes free T3, free T4, and TSH investigations are ordered. They are also almost similar. So one is this. Then the second blood tests which are commonly done for these patients are thyroid antibody levels. So they will these antibody levels will tell us about the autoimmune disorders, such as autoimmune disorders primarily are two. One is Graves' disease, which causes hyperthyroidism. The other is Hashimoto's thyroiditis, which usually causes hypothyroidism. So the levels of thyroid antibodies, they are elevated in different disorders. So these are two blood tests. Then the third common investigation which we ask for the patient is an ultrasound of the neck. The ultrasound of the neck gives us an idea of the size of the thyroid gland. Also, it gives us an idea whether there are any nodules, and if there are any suspicious nodules, because there is a small chance of these nodules turning cancerous. So this is the third investigation. And the fourth one is if we find any suspicious nodules, yes, we can order an FNA investigation, that is a fine needle aspiration cytology examination. So herein a small tiny needle is put in this nodules, and some tissue is aspirated, some cells are aspirated, they are investigated in the pathology lab, and based on that we can know the nature of these nodules. Some other investigations such as CT scan, MRI, they are not very commonly used for thyroid glands. However, they have got specific indications.
Right, right. Moving to the treatment options, what are the treatment options that one can avail for these common thyroid disorders?
So means the treatment options, again, they will depend upon what we are getting after examining the patient, after going through their detailed history and symptoms, and also the investigations which we have done. So usually the hypothyroid patients, they are being given thyroxine supplements. So thyroxine means we commonly see patients they are taking some daily dose of thyroid medications in the morning. So they are actually not medications, they are thyroxine hormone only, and they are being prescribed to patients when their thyroid gland is not producing enough hormone which is required for the body requirements. So we have to supplement it from outside. So this thyroxine is usually not having any side effects, and it is very well tolerated by the patients. Then the second disorder, which is hyperthyroidism, yes. So hyperthyroidism is actually treated by a combination of different things. One very commonly used treatment for hyperthyroidism is radioactive iodine therapy, which I would like to tell you in detail. Yes.
Right, right. So yeah, moving to nuclear medicine and your field of expertise, tell us about that and the treatment option, that is the radioactive iodine therapy, and how is it used to treat the disorders and certain type of cancers.
Thanks for asking this. So means at nuclear medicine department, nuclear medicine and thyroid, they are basically very much interrelated to each other since the beginning of this field. And this radioactive iodine is actually a congener of the normal iodine only with the radioactive properties. And just as the iodine is absorbed by the thyroid gland to produce hormones, this radioactive iodine is also absorbed by the thyroid gland in the similar mechanism using the same transporters. So this is being used for the treatment of thyroid disorders since 1940s. So it is a very safe treatment. We are using it since last 70-80 years. We have got very enough data of around means multiple patients. So means nuclear medicine in thyroid is basically having both diagnostic roles as well as therapeutic roles. So in terms of diagnostic roles, we do thyroid scans. So thyroid scans, they are being done to assess the functionality of the thyroid gland, to assess the nature of the nodules. We come across nodules which are functioning. We come across nodules which are non-functioning. So these non-functioning nodules, they are having a slightly higher chance of turning cancerous, whereas these functioning nodules, they don't turn cancerous. But again, we come across the function of the thyroid gland, and the other role is in the assessment of thyroid cancers. We do whole body scans, whole body iodine scans, to look whether the thyroid cancer has spread to any other parts of the body or not. They are very sensitive investigations. So this is the diagnostic role. The therapeutic role is for the treatment of mainly one, hyperthyroidism. The second is thyroid cancers. So for both treatment purposes, we use actually iodine 131. This is a radioactive iodine, which has both means this means going into the technical side of it. Iodine 131 has both gamma rays and beta particles. So gamma rays are used for imaging or diagnosis. Beta particles have a therapeutic role. They go and kill the cancer cells or the hyper functioning thyroid cells.
That's great. With the radioactive iodine therapy and the use of radiation, people are wary of their safety. So, and are there any safety measures that one should take while going through the radioactive iodine therapy, which you elaborated, or other thyroid procedures to minimize their radiation exposure?
Yeah, so again, so I would like to say that first, it is a very safe procedure because we have got enough data and it has been in use since last many decades. So decades of experience is available for this. Yes, it is a radioactive medicine, but it is a very highly targeted kind of a treatment. It will not affect the other body organs. The thyroid cancer, the thyroid cells actually absorb this radioactive iodine from the blood, and it basically acts only on the thyroid gland or the thyroid cancer cells if they have spread to other parts of the body. So basically, it does not have any deleterious side effects on rest of the body parts. Yes, we have to take precautions when we give radioactive iodine to a patient. Patients are given some precautions such as they have to stay away from some pregnant ladies and small children for a certain duration of time, say 1 or 2 weeks. Then they have to flush out extra amount of water when they are going to common toilets. Then the other thing is they have to avoid cooking. They have to keep their utensils separate for a few days. Then they can always mix and mingle with people after those isolation period is over. So this is small amount of precautions which we ask the patients to take, and patients are usually comfortably taking it once they have been explained it properly.
Right. With these thyroid disorders going bad, or their situations getting worse, are there surgeries also that you prescribe, and what are those? What is that point where you prescribe surgeries, or what is that treatment option? Thyroid
Yeah.
disorders.
So yes, surgery do have a role in thyroid disorders, primarily in hyperthyroidism, and the other role is in thyroid cancers. For hyperthyroidism, at one point of time, surgery was the only treatment available for people. But due to the availability of some other safer and non-invasive methods, surgery is, I think, done only for 1 to 2% of people suffering from hyperthyroidism nowadays. That too, when people have got such big enlarged thyroid glands such that they are compressing upon the food pipe or the windpipe, so then we do it. Or if the for cosmetic reasons, some people, they don't want this enlarged thyroid sitting in front of their neck. So for that indication, we do surgeries in cases of hyperthyroidism. For thyroid cancers, I would like to say that surgery is the first line of treatment. And in thyroid cancers, the thyroid gland is removed completely, and followed that it is being followed by radioactive iodine treatment. So surgery do have a role, yes.
Okay. But doctors do not prescribe surgery, although it can be an elective surgery when the thyroid gland is a very big, but they do not advise it until it is pressing against the food pipe, and it is creating problems, because it is believed that it can go away on its own as well. Am I right? Or
Sir, there are 2 points to it. Yes, the surgeon nowadays people are also, means once you have got an option of a treatment where which is non-invasive and where the surgeries can be avoided, people want to try that first. Yes, and it should be tried. And however, the surgeries, they have got a definite role. Yes, they have a very specific indications which I already told.
yeah.
But surgeries have their inherent some risk and complication rates also. In means in even in the hands of experienced surgeons, there is a slight risk that it can hamper the voice in the future, or they can cause damage to the parathyroid glands which are adjacent to the thyroid gland. So all these risks are also there. So people want to move, means they initially want to try the non-invasive ones, and only if it is being untreated by those, then they can always move to surgeries.
Considering that it is untreated by the meds, and a person is having that enlarged gland in their and in their neck, say it is the goiter, but it is not troubling the food pipe as yet. So would that person should that person go ahead with the surgery, or should that person wait for it to create some sort of uneasiness?
Means we are talking about hyperthyroidism at present. So
Okay.
hyperthyroidism is actually increased functioning of the thyroid gland. So even if it is not compressing the food pipe or windpipe, it is actually causing trouble to the patient. So it has to be managed either with the medicines, antithyroid drugs, or with radioactive iodine. In more than 90-95% cases, we are able to control the things with these two methods only. And if still untreated, or if still it is causing some trouble, then yes, patients can go for surgeries.
Right. So, are there any precautions to keep away the thyroid disorders? And let's bring that genetic risk in this also? What, knowing that a person has a genetic risk, what can they do, and what the normal people can do to avoid thyroid disorders?
Avoidance, yes, they can have a balanced diet with supplements of iodine in the form of iodized salt that is sufficient. Other than that, if there is a strong genetic history, then of a particular disorder, they can get themselves screened regularly. They can be self-aware if there is a genetic history of thyroid cancer in the family. Yes, so then patient should be more aware about any lumps originating in the neck or any discomfort in the neck. They can get themselves evaluated by the doctor. They can get themselves tested frequently. And if suppose there is a genetic history of hyperthyroidism in the family, if some symptoms are arising, then yes, the family members can be screened for that.
And
Only if there is any symptoms.
yeah. Coming to my last question, which is the advancement in thyroid treatments. Can you highlight some of them, some of the recent advancements in nuclear medicine per se and other approaches to treat thyroid disorders?
Yeah, so I mean, a lot of research is presently going on regarding what happens is these thyroid cancers. There is a lot of research and a lot of recent developments have taken place. What happens is initially we are able to manage a lot of patients with the help of surgery followed by radioactive iodine. Even if the disease is metastatic, means the disease has spread to other parts of the body, still there is radioiodine actually helps plays a major role in controlling the disease. But eventually, after years of the disease present there, that the cancer cells they start becoming non-responsive to radioiodine. So that situation is known as iodine refractoriness. So for that, a lot of research is presently going on in the form of targeted treatments. We are doing some peptide radionuclide receptor therapies or PRRTs. These are lutetium therapies looking at some different targets in the cancer cells and ultimately killing the cancer cells. So this is the newest radionuclide therapy which is available. Apart from nuclear medicine, there are a lot of chemotherapeutic drugs and targeted drugs such as lenvatinib or tyrosine kinase inhibitors. They are presently available for such patients. And the most recent one, immunotherapy, is also being tried and tested in such patients with very good results. So ultimately, all these treatments have been able to prolong the quality, means prolong the survival and also improve the quality of life for the patients.
Right, right. Well, thank you so much, Dr. Pruthi, for joining us here. And to all the viewers, a balanced diet and genetic predisposition. If you have, you can get tested or screened regularly with the test that Dr. Ankur Pruthi mentioned in the talk earlier. Thank you, viewers, for joining us. Thank you, Dr. Pruthi, for joining us here.
Thank you.
Yeah. Thanks again.